COPD exacerbations. Hello and welcome to the next talk in the Breathing Space COPD Empowerment course. Today I would like to spend some time talking about COPD exacerbations, as these can be very problematic for people who suffer with COPD, and trying to prevent their occurrence is important in looking after your lungs. It is also important to be aware of what an exacerbation is so that you and your nurse or doctor can take steps early in order to prevent you becoming more unwell and to aid prompt recovery. So what is an exacerbation of COPD? Put simply, this is a period of time during which your COPD symptoms become more severe, typically happening over a short period of time ranging from a few hours to over the course of the day. There are many possible causes, of which the most common is an infection, with viruses being more common than bacterial infections. It is important to note that infections are not the only cause of COPD exacerbations, and other causes can lead to these, such as pollution levels, exposure to smoke and other fumes, such as those given off by cleaning products and paints. Changes in the weather can also be a trigger for COPD exacerbations, along with interruption to usual treatment, such as if you forget to take your regular inhalers for a period of time. The main symptoms of an exacerbation include breathlessness, which gets worse and does not improve in the way you would normally expect. You may find that this does not respond to your reliever inhaler in the way it normally would, and resting also does not improve these symptoms. Along with breathlessness, people typically cough more than normal, and they will often notice that the sputum they are coughing up has changed. This could include coughing up more than normal, along with a change to the colour and also consistency of the sputum. So what is the treatment for a COPD exacerbation? Before discussing the treatment, it is important to be aware of the situations in which you need to contact 999 or seek immediate medical attention. The NHS website recommends calling 999 or going to accident and emergency immediately if you are feeling breathless and have severe difficulty breathing. For example, you are gasping, choking, or not able to get words out. They also recommend calling 999 if your chest feels tight or heavy, if you have any pain that spreads to your arms, back, neck, or jaw, if you notice your lips or skin are turning very pale, blue, or grey, or if you suddenly feel very confused. If any of these situations apply, you should contact 999 immediately. You should not drive yourself to accident and emergency, and if you do decide to make your own way there, you should ask for somebody to accompany you and drive you. In terms of managing a COPD exacerbation in the community, there are a number of treatment options that can be used. Ideally, you should have been issued with a self-management plan by your GP practice, and if you do have one of these plans, then please refer to it. If you do not have one, I would recommend that you request one during your next COPD annual review. A self-management plan is essentially a step of instructions specific to you, telling you what to do if your breathing becomes worse. Generally, the management of COPD exacerbations involves increasing the use of your reliever medication, taking a course of oral steroids, and depending on the cause, a course of antibiotics. So, in the first instance, you can use your reliever inhaler, which is generally the blue one, more frequently, and you may find that this is enough to help manage your symptoms. If, however, this is not effective, or you feel that your breathlessness is affecting your activities of daily living, then a course of oral steroids is often required. Steroids work by reducing inflammation within your lungs to help improve the breathlessness associated with an exacerbation. Typically, you will be given 6 to 8 steroid tablets to take a day for up to 5 days. Antibiotics are not always indicated in a COPD exacerbation. For example, if it is felt that this has been caused by a virus or if it is due to other reasons such as air pollution. It can, however, be very difficult to determine the exact cause, and we tend to be guided by the sputum that you are coughing up to determine whether antibiotics are needed. Typically, if you are breathless and have noticed a change in your sputum, such as you are coughing up more than normal, or it has changed in colour or consistency, then a course of antibiotics will usually be recommended. There are a number of different antibiotics that can be used, and the exact choice of this will be determined by your healthcare provider. In terms of recovery, you should typically start to feel better within 48 hours of having started treatment. However, your symptoms may not have completely gone by the time you have finished this. This does not mean that the treatment has not worked, as it can take up to 14 days for things to completely get better. You should, however, feel a lot better by the time you finish the tablets, and you should notice that over the following days to week, your symptoms continue to improve. When should you seek further help? It is important that if after 48 hours of having started treatment, if your symptoms have not improved at all, that you seek further help and discuss this with your GP practice. If at any point you feel your breathlessness is becoming worse despite treatment, if you develop any chest pain, if you cough up any blood, or if you become more confused, then you should seek further help either from your GP surgery or by contacting the 999 team or attending accident and emergency. I'd now just like to talk a bit about what would happen if you did need to go into hospital. Hopefully, by starting a course of steroids and antibiotics and by using your reliever medication more frequently, this will be enough to help you recover quickly. Unfortunately, there are some situations that despite this, your breathing can continue to get worse, and this may require you to be assessed or admitted to the hospital. Common reasons for needing to go to hospital include symptoms such as confusion, your breathing is getting worse, or if your oxygen levels are lower, typically below 92%. So what will they do in hospital? Upon arrival at the accident and emergency department, a number of tests are likely to be carried out. You will often have a blood test, which is done to help us determine whether you are more likely to have a viral or bacterial infection, and also determine how severe this might be. You will usually have an X-ray of your chest in order to determine whether you have a more severe lung infection called pneumonia. You may also be started on oxygen, and you will often be given medication for a machine called a nebulizer. For those of you not familiar with a nebulizer, this is a device which allows us to deliver much higher doses of the medication that is in your inhaler, and this can be done in combination with oxygen to help your breathing. You might be given antibiotics for a drip, and these may be changed from the ones that you were originally taking before you came into hospital. Another test that is often performed is something called an arterial blood gas. This test involves taking a sample of blood from the artery at your wrist. This enables the medical team to measure very accurately how much oxygen is in your blood, and also to check the levels of carbon dioxide and the acidity levels. One of the things that can happen in a very severe exacerbation of COPD is that the levels of carbon dioxide increase, which makes the blood more acidic. This can lead to damage to your organs and can be a sign that you're becoming tired from having to work hard to keep breathing, and therefore requires further support with this. In this situation, patients are often started on a treatment called non-invasive ventilation. This involves a tight-fitting mask being placed on your face, and oxygen is then forced into your lungs under pressure. This helps to support your breathing if you are getting tired and reduces the work of breathing that you need to undertake. So what should you do following recovery from an exacerbation? It is very important that you do not consider exacerbations of COPD to be a normal part of your disease. Each exacerbation does result in further damage to your lungs, and recurrent exacerbations can dramatically worsen your symptoms over time. It is therefore very important that you are seen by your practice nurse or GP following an exacerbation, so that they can try to ascertain what has caused this and see if there is anything that can be done to prevent further exacerbations. These reviews should include things such as directing you to stop smoking services, reviewing your inhaler technique to ensure that this is correct, and if needed, altering the medication of your inhalers. You may also be offered a referral to pulmonary rehabilitation, which as previously discussed is a very good method in reducing the risk of further infections. If you are having recurrent exacerbations despite optimal treatment, then referral to the respiratory team at the hospital may also be required. So what are the take-home points from this talk? Firstly, if you do develop symptoms of an exacerbation, please follow your self-management plan. If you do not have one of these, then please request one at your next COPD review. Secondly, if at any point during an exacerbation you feel you are getting worse, please do seek medical help sooner rather than later so additional treatment can be implemented. Thirdly, it may take around 14 days for your symptoms to completely resolve, or in some cases longer. However, you should notice that you are feeling significantly better within 48 hours of having started treatment. If after 48 hours you do not feel that you are getting better, please do seek further help. I hope you have found this talk on COPD exacerbations useful, and we will now take any questions.